Hey guys, it's Renee.
And I'm David. We're just going to go through a full 4 eyes assessment on a patient, looking at all the areas of pressure that you should be looking at and underneath all of our devices and everything. So this is Ryan, our assistant patient.
Thank you, Ryan. No paramedic students were hurt in this video.
All right, so to begin with, you want to kind of, whatever works best for you so you can always remember it. I like to work in a waterfall, starting from the head, work your way all the way down. All right, so we should be checking and alternating this. All right, so you actually want to peel it back, check, make sure you don't have any pressure injuries forming underneath.
And alternate sites.
Yep. Some people don't know that these have multiple sticky layers for when you alternate your sites, and you should be alternating it regularly. Check underneath your Dobhoff NG and the Nares. Try to reposition it. If you start to get areas of pressure in there, you can actually use the Mepilex foams for your nasal cannula. You can actually wrap it around there to help prevent pressure on there. Make sure you're checking underneath your ETT, alternating sites. And when you alternate, make sure you're checking both the lips and underneath these areas of hard plastic. And if you can, right underneath the nose. Not much we can do about your pads until they come off. At the same time, check your ears, especially if they have a nasal cannula in there. And you should always be doing this with a 4 eyes, so you should always have someone to help you. So Renee will hold my collar here for just a moment. I'm gonna slide the bed out for you. So just have somebody hold your collar for you while you check underneath. And this is a fantastic time to check underneath your trach flange. I think it fell out. Make sure there's no pressure injuries underneath the flange. Make sure your collar is not causing any pressure injuries. When you get it back on, you also want to check underneath the ears. Make sure they haven't been being pressed in. All right, and usually I'll save like the back of the head and everything until we fully turn the patient. So continuing to work our way down, you want to check underneath your central lines. And especially like when you do the dressings and everything, you can check under there, but make sure the lines aren't impacted on anywhere, aren't pressing in, aren't causing any pressure injuries. At the same time, always take off your board and check anywhere that it could be causing pressure. So back of the hand, you really want to check inside the hand and check your A-line as well. All right. You can check your chest tubes, lift up just a little bit. Please don't remove them. When you do your dressing changes, you can check even closer in. Make sure they're not pressing in, causing any injuries in there. You can always put a little bit of gauze or a Mepilex in between the skin and the tubes if it's starting to cause any injuries. Remember, you should be assessing and alternating areas of pressure for your Foley every 2 hours.
Ensure that you're using a stat lock to prevent any pressure injuries.
And you can also put a stat lock in different locations so that you can alternate the area that it's in as well. And then moving down, you always want to check underneath the heels, all the way underneath. Fully fell out. My assistant left. All right, now we're gonna turn and we're gonna do the rest of our areas. Really think about anywhere that you have pressure. So you're gonna have pressure on the back of the elbows, your heels, any bony prominences. So you're gonna have pressure on the back of your head. Depends on how thin or cachectic the person is, but a lot of times you'll get pressure just on the spine if they're really thin and bony. And then moving down like the coccyx, and specifically the coccyx and the ischial tuberosities on the back. All right, so we're gonna turn our person here. All right, Ryan, we're gonna be turning you towards Renee just so we can do our full skin assessment. Take a look at everything.
On your count of 3. 1, 2, 3.
All right, so check your occipital area, check underneath the edges of your trach, and they should be, or your trach, your C-collar, and make sure it's padded. Check your shoulder blades, coccyx, ischial tuberosities, and take another look at your heels while they're turned. All right, and then also make sure you have a Mepilex foam, dated, initials, every 7 days. All right, all done?
All right.
Thank you, Ryan. We are
Ryan.
all done.